totally knew that. Hi, everyone. Welcome to this conference. This is just a little bit of levity ahead of what is likely to be a pretty serious discussion, an important discussion that we're actually having here. Thank you for joining. And I'd like to introduce, just start off by introducing myself. My name is Tushar Singh. I'm the moderator for this panel. I'll be introducing the panelists shortly. You may recognize me from some previous siberX events that I've attended or spoken at. And I'm the CEO and founder of several startups, including edtech startups, medtech startups. And in this particularly exceptional time, I think we've all been looking at the changes, massive changes, and both the healthcare and education industries have been going through massive changes. In this particular session, we're going to focus on securing mental health services, and we're going to be focusing primarily on that education technology side. We're going to be speaking with a number of panelists here today, 3 of them. I'm going to start with a quick introduction on their name, their title, a quick kind of sentence, and then I'm going to pass it off to them to actually speak about themselves a little bit. And then we'll go into some of the questions, pre-planned questions. We'll take questions as well from the actual audience that's viewing this, and then we'll go from there. All right, so Medha Saraiya is the CEO of ConnexHealth and a licensed nurse. ConnexHealth connects healthcare seekers to vetted, trusted, and professional healthcare providers nearby and throughout Canada. Medha?
Thank you, Tushar. As Tushar mentioned, at ConnexHealth, we connect healthcare users with healthcare providers. During these uncertain times, we have changed and adapted to the needs of the community. And some of the services now that we are offering is helping pharmacies make deliveries to clients. So home deliveries, that's something we're doing. But at the same time, as of today, our portal is able to support mental health services. And we are especially providing mental health services to young adults or people with physical and cognitive disabilities. So those are the areas that we are going into.
All right, thank you very much. Next up, I'd like to introduce Nicole Smith, founder of You Are Worth More Ministries. Since 2012, Nicole has been involved in the battle against suicide. Out of a heart of compassion for preventing teen suicide and self-harm, she founded You Are Worth More Ministries. Nicole?
Well, thank you so much. I appreciate this, and I'm very happy to be here today. I am Nicole, and You're Worth More began in 2012 as a simple youth event, and it came out of a situation where my daughter lost a friend to suicide, and it just derailed her, and she went through some counseling, and she did something she was told by her counselor, do something to help commemorate. And so she did a Facebook page called You're Worth More Than You Know, and hundreds and hundreds of kids joined this Facebook page to do a one-day commemoration of somebody that they'd lost. So that just moved my heart. And I looked at my husband and said, we have to do something. So we initially started by doing a youth event where we spoke, a message of hope and a message of life. And it took them on a journey to a place where they were ready to hear and listen what we had to say. And from that, we've grown the organization to now include workshops on assist training, which is essentially suicide first aid training. So I'm all about equipping people so that they know what to do if they find themselves in a situation where they're speaking to somebody who has thoughts of suicide, so they can, kind of figure out how to maneuver that piece and then get them to connect with the people that can help them, beyond that. And so that's essentially what we do. And we continue to do, of course, events and that kind of thing, because youth are, part of my heartbeat. And I definitely want to replace the lies that they believe in their heads with the truth that they are valuable and have something to contribute in this world. And that's it.
Thank you, Nicole. And then finally, we have Karim Mamdani. He's the president and CEO of Ontario Shores Centre for Mental Health Sciences, a public specialty hospital that provides specialized assessment and treatment services for people living with complex mental illness. Karim?
Thanks very much, Tushar. Ontario Shores is one of 4 freestanding psychiatric hospitals in Ontario. We're a large facility. We have about 340 odd beds. We serve over 90,000 visits. A significant sort of, pardon me, that's what you're hearing is something in real time from us. But it is something that is, to Nicole's point, something that's close to everyone's heart, particularly in this period of the pandemic. And so I look forward to the conversation.
All right, great. So for everyone that's attending, we are going to be taking questions and doing Q&A as we go throughout. We have 4 prepared questions in advance. And as I go through this, I'll be also asking a few more. We've encouraged the panelists also to engage in an organic discussion. They might be distracted from time to time because everyone still is involved in their day-to-day lives, and there are urgent measures that do come up, as you heard as well recently. You may also see young adults and children running through the background. That is just the situation that we find ourselves in at this time. And please don't be distracted, stay focused. And to start with that, I'm actually going to start with a switchback kind of position, starting with Karim. Is in light of the current pandemic and the heightened amount of digital interaction, what are some of the mental health concerns that have emerged? So we're going to start with Karim, then we'll go Nicole, and then Medha, and then we'll just kind of keep going back and forth from there.
Perfect. Thanks very much, Tushar. So, yeah, I mean, I think there's no doubt that isolation is going to have an impact. Right? We know that it's having an impact on addictions. There was a study done, an Ipsos Reid study done for the Addictions Mental Health Organization of 42% of—
Code white, all clear. Code white, all clear.
Thanks. So the 42% of Ontarians that were polled reported an increased substance use and gambling during the pandemic. So we know that that's going to happen. There was another study done just recently by the Mental Health Research Canada sort of group, and during COVID, they've identified that 61% of those that are surveyed felt that they would experience greater anxiety, and that's a jump in comparison to pre-COVID when that number was around 28%. So the reality is that we will in fact see, people are talking about it as an echo pandemic or an echo boom, and of course frontline workers who are working are also going to be feeling the effects of trauma and the impact of their own families. And so I think you're going to see quite a significant impact as time goes on, because it's not just about a short period of time, but a much longer period of time.
Mm-hmm. And yeah, I absolutely agree. And so for me as a suicide first aid trainer, my alert buttons are up high going, people need to be equipped to know how to deal with this, because some people maybe are probably surprised at how anxious they're feeling, because they're normally not anxious people, but as a result of all this, things are starting to develop, and they're surprised at how they're handling things. And it may push some people towards an area that they never thought that they would get to, but here they are. And they're surrounded by other people, and these other people need to know how to handle this. And if they're not equipped, they're likely to say or do something wrong, quote unquote, or say the wrong thing, and or feel so helpless they don't know what to do. And you can call 1-800 lines, but if you can't get the person that you're dealing with to agree to the phone call, then the 1-800 line is not going to help you much at all at this point. So my concern is the overflow of what's going to happen as we continue to move forward, because some people are great in the crisis, but then there's post-crisis that we need to think about, and being equipped to deal with that is key, I think, in this kind of a situation.
Well, also the crisis has brought about a lot of other areas too, like domestic abuse.
Yeah.
Unfortunately, that is on the rise as well. Another thing is the media overload. We've had crises in the past. This is not the first time we've had crisis. We've had SARS, we've had 9/11, things have happened in the past. But at that time, we did not have that constant social media input. Now we've got that level going in. So unfortunately, for a lot of people, they don't know when to pause, when to take that break, when to disconnect, because it's the 24/7 just overflow. And that is what's causing a lot more anxiety, a lot more behaviors. And I see the other aspect of it, that too, with seniors who are now on, because of social distancing, they're completely isolated. And a lot of their behaviors are showing up because they are on decline cognitively due to dementia or other underlying situations or issues. And you're seeing their issues coming out and exaggerated. So that brings in another dimension that families now have to deal with.
Well, this is extremely complex, and I think you've all identified just how complex the situation is. You've highlighted how we need to involve community support, that we're going to have continual repercussions from this. That also at the same time we're seeing a spike in other areas as well, which can be a byproduct of not addressing or adequately addressing or supporting any sort of mental health areas that we do need to support. You've also highlighted, the constant news cycle. And I will say this is that as someone who's been doing digital media for a long time, is that people are seeking answers, and they're constantly seeking answers because they want to feel comforted. Part of that, the toilet paper flying off the shelves was people were just trying to solve something through an inexpensive solution. And I think we have to recognize that there aren't inexpensive solutions to this. So as we push to deliver more services virtually, this is giving rise to security and privacy concerns, which are not inexpensive to solve. Can you highlight some of these and how they can be addressed? And this time we'll start with Nicole, then we'll do Medha, and then Karim.
Okay. Well, the reality is that using programs like Zoom and stuff, you have to know how to put the measures in place so that things don't get cut in. Like for example, recently I hosted a webinar, and we got Zoom bombed, and it was like, oh my goodness, how did this happen? Well, I found out after that I hadn't set the parameters correctly, and so these young people were able to hack in and do their thing, and so these things happen. Now imagine that happening in the middle of a telehealth conference or counseling session, something like that. That could derail somebody. So these measures have to be taken into consideration. You really have to do your research and know how to use the technology, because people who provide counseling aren't necessarily people who are super tech savvy. They just know how to do what they do best, and now they're being forced in a situation where they need to use technology in a way they've never imagined they've had to do. And so, these things are important to take into consideration when moving into that kind of a world. You know
what? I completely agree with Nicole on that one, because my background is a nursing. I'm a nurse by profession. For me, even though I own an IT company now, it was a transition that I had to learn. And for a lot of healthcare users or healthcare providers like myself, and I can speak for most nurses, we don't like change. And us adapting to a new technology is a challenging thing to do. So again, security is very crucial.
All right, Medha's experienced a few connection issues. And what we'll do is that while we wait for her to return, Karim, if you'd like to go.
Sure, and it's actually my first comment perhaps helps to answer a question that has come up on the chat a little bit. What we have found in our research for particular conditions, so mild to moderate depression and anxiety as an example, that the use of supported CBT, cognitive behavior therapy, using a virtual way of connecting with an individual. So supporting them through a virtual approach, but having coaching available either by phone or by a screen is actually as effective in many cases as face-to-face conversation. And so I would say that even in this circumstance, in this sort of scenario, people should feel quite comfortable that they can reach out remotely. We do have a number of services, our intake service at Ontario Shores can put them in touch with, with a clinician, and we can support them through a very prescribed methodology to actually give them help. So it isn't just group or talk therapy, but there's a very prescribed way that we would work through with somebody over 4 to 6 sessions, maybe a little bit longer, to really help them with mild to moderate sort of anxiety and depression. So that would be the first thing. So electronically, we can do this. The second thing I would say is that, we do have to worry about privacy. We do have to worry about that. But there are, again, approaches you can do for that. As a healthcare custodian, we have specific rules that we have to follow. And what we would do is we would follow those privacy and security legislation by undertaking things like privacy impact assessments or threat risk assessments. So taking prescribed, again, approach to determining how we're going to undertake a virtual environment. We would test that, we would assess the threats to that environment, and then we would ensure that we have mitigated those threats. So there is an approach, and I don't think people should be worried about taking a virtual approach.
Okay, and thank you for that. And I'm going to come back to that one, but Medha has returned. Medha, I believe you were speaking about some of the aversion to change.
Yes, and this is what I mean by technology. Unfortunately, it can drop on you. But a lot of healthcare providers, what I was saying, don't like change much. And getting them to use technology that they're not comfortable with is pulling them out of their comfort zone in a way. So giving them the secure means and having those, as what I heard at the end, Karim saying, those security measures built into technology would really help. Mm-hmm. And those are some of the things that developers of technology need to be mindful of, is the people that they're helping, the healthcare providers, as well as the clients who might be in a compromised situation, and giving them the tools, the correct tools.
Okay, I'd like to add a few items here as well, given that we're at a security conference, and I do quite a bit of security for MedTech. So our standards between Canada and the US are a little bit different. In Canada, we have PIPEDA, which covers the privacy requirements more generally. You might have heard of something called HIPAA, which is actually an American requirement for insurance companies, is where it really started. And then it's being applied more broadly. You might also have heard of GDPR, which applies to European Union citizens. But even if you have EU citizens on your products anywhere else in the world, EU law can apply. So there's all these competing standards. And the certification requirements for each one can be quite extensive. So in the US, there's something called HITRUST, which is an industry standard that takes somewhere between 6 months to 2 years to actually go through the compliance process on. So given that we're having to go through some rapid change right now, and by the way, everyone, I'm off script a little bit for the panelists. Given that we have been thrust in this environment, it's really highlighted the gaps in technology support. It's highlighted the lack of infrastructure we have to support people both on the medical side, ed tech side, anywhere else. And certainly companies have more flexibility in working with their employees. We don't have that same luxury. And it is a luxury to do that with people that we support in what are more public services or healthcare services. Mm-hmm. And that's given rise to a cost. So where is that cost going to be borne in order to not only secure the services, which everyone's spoken about we need to do, but to actually build trust in the security of those systems and reliability of those systems? So this time, Medha, we'll go start with you, then Karim, and then Nicole. All right, I think Medha's left just connection issues again. So then we'll go with Karim on this one.
Yeah, no, thanks. So I would say it's a really tough question. From our perspective, we were lucky enough to have begun the journey down the path of virtual care a number of years ago. So we started the process quite a few years ago. The healthcare system has an infrastructure that has been put in place for screen to screen sort of connection through the Ontario Telemedicine Network, or OTN. So we were a strong utilizer of that network, which is a secure network in place. And in addition to that, probably about 2 years ago, we began work with a vendor from the UK who would provide us with the infrastructure and the protocol for electronic CBT, or cognitive behavior therapy. So we had already begun that journey, the move towards virtualization of care through those different initiatives. Having said that, we're in an unprecedented sort of a situation. We, in fact, are now having to ensure that our therapists are in a secure space to be able to have very personal conversations. So they may be at home, so we have to tell them, okay, you have to make sure that you're in a space where perhaps other members of your family who are present don't have access to, or cannot overhear the conversation, and you might want to be using a phone to do that. We have had some people use Zoom and other devices, but or other platforms, but those are less secure, as Nicole mentioned, just based on her experience. They can be less secure, and so we do have to figure that out. And I think the implications of that are going to come, I would say, probably 1 month, 2 months, 3 months down the road, where people are going to move to platforms that have that security or have that certification. Right now, it's a bit of a wild, wild west, but people will move to those certified products because of the risk associated with exposure.
All right, so Nicole, I'm going to ask Medha just to speak in case her connection drops again. So Medha, could you please go?
Sorry, what was the question, Tushar? I think I missed the question.
Okay, so I was speaking about the costs associated with securing mental health services, and where are we going to bear those costs in order to actually do this?
Well, unfortunately, with the changes happening in our healthcare system, privatization is something that is coming along. A lot of the costs will, unfortunately, be passed on to the consumers. So to give you an idea, like in private care, so personal support workers, the hours that the government was providing care for those are dropping regularly and constantly. So families now have to pick up the slack. That is something that I'm even seeing in mental health is a lot of the community-based, the families have to pick up the slack and they have to pay for it. So privatization is happening, but it's up to the companies. Like for ConnexHealth, we are bearing a lot of the cost to make sure that our portals are secure, to make sure that the care that we delivery that we provide is in a right way, to ensure that we train our care providers and our care users to maintain their own privacies. Because the onus also comes on the user to ensure that they don't, as Karim said, it's not only the care providers who need to be in a safe place physically, but it's the users too. They cannot be in a public space talking to a care provider. So we have to make sure we are educating both.
Yeah. And yeah, I agree completely. I won't have much more to add to that. But the reality is that when you're looking, like, I mean, there's the big institutions, but then there's a lot of private practices. A lot of counselors are either, doing it on their own, or they're part of a small organization. And so the costs of the cybersecurity involved in doing all that could potentially be too much for an organization. So they have to use what's available to them that's within their budget. So I would say that it would even be wiser to also, for these businesses or these organizations that have the more accessible type of platforms, to maybe start considering upping their own game so that we don't have to, you know, spend so much money that we have to drop what we're doing because we just can't. So that's, you know, the cost is going to be, and as Medha said, the consumer is the one that's ultimately going to pay for this, because it always has to, the buck has to stop somewhere. And half the time it ends up being to the clients and the consumers rather than anybody else, because where else are you going to go?
It's important points. So for those attendees that are joining, you might not have security in healthcare, so I want to give you a little bit of information on that. We need security in general in healthcare and privacy in general in healthcare because primarily of stigma and what happens if that information gets out. So for example, if you go to the doctor's office and someone you know finds out about some reason you're being treated, and that system is insecure and you know the system is insecure, you're less likely to actually try and seek treatment for that. And that overall reduces the health of society. So society as a whole becomes more unhealthy when we don't have secure healthcare services in general. The aggregation that happens with digital services has incredible ramifications if you don't actually secure it. Because unlike going in and breaking into a doctor's office to steal medical records, breaking into an online environment which is hosting a wider scale will actually net you a lot more private information. So this is why healthcare moves fairly slowly, as does education, because if you know what someone is educated on or how they're performing, that also has an impact on them. On healthcare, it's even greater. If someone knows that you have some particular disease, treatment, mental health that you're being treated for, and there's a chance that someone else could find out about it, you're far less likely to go and actually seek treatment. And that affects all of us. That, as you spoke about, and we spoke about the costs, it affects our wider community. So we're almost paying ahead of time for, paying it ahead of time, sustaining, rather than actually responding in an acute manner. We're really looking at this as something that we want to address in advance and then have a lower cost from the beginning. Which goes into, I think, my next point. When we're talking about these ramifications, are virtual mental health services the future, right? Like what works, what doesn't as part of this? And this time we'll start with, I think, Nicole, then we'll do Medha, and then Karim.
I think yes and no. I think you can never really replace, person to person, especially when it comes to mental health, that person to person interaction, because when you're sitting in front of a person, the body language that you can see, the flexibility of the tone, that sometimes just that feeling of being in a room with somebody else can never really be replaced by technology. But at the same time, having mental health care or any kind of healthcare on technology is a huge advantage, especially for people who are limited by transportation. They can't get to where they need to go, or they're limited by physical issues. They're just, those are great reasons, or they live in a really remote area, right? I mean, I've heard of care being given to people who are way out in Nunavut simply, and there's nobody there. So they're, it's all done remotely, which is great. But, I think you'll see an increase in the technology being used, but I don't think it'll ever replace the person to person type of care.
You know what? I could not agree more with Nicole on this one. Is you need that in-person care. As humans, we are wired to be talking to people in person. Technology is a tool to enable that.
Yeah.
Technology is not replacing that.
Right.
So yes, we will see increase in virtual care, and yes, we can reach a wider audience with virtual care, but at the same time, we need to know that technology is a tool. It's not replacing. There are some times where you need to have that in-person intervention.
Mm-hmm.
So I think when I hear what Nicole started with in terms of the person-to-person conversation, that is the richest form of interaction that one can have, because so much information that you can, in that face-to-face, you pick up. You know, the body language, the tone, there's so many things. Often when we're on virtual, we're scripted, we're, you know, we're trying to create an image when you're virtual often. So sometimes that's very hard then for the individual on the other side to be able to tell what's real and what's not so real. But it's much more difficult to do that when you're doing face-to-face. So, but the question really is there a continuum of service that can be offered depending on the level and severity of the individual's suffering? And so I think that there is. I think, you know, I'll start by saying that, you know, at Ontario Shores, we have a large waiting list. So we have, you know, almost 3,000 people on our waiting list. They're waiting about 100 days on average to get to one of our services, whether it's a clinical service, whether it's, you know, electroconvulsive therapy, ECT that we might offer. So the people are waiting quite a long period of time to get to service. So you have to look at that continuum of offerings that you have available and say, we call it stepped care. That is, if someone is at a very low level of service requirement, could we offer that through something like an internet-based offering? If they're at a little bit higher level of service need, could you offer that through a coached form of therapy? And then if they have the greatest need, then maybe that's the face-to-face opportunity. And in each one of those steps, the amount of human intervention that's required is different. So for the internet-based therapy, it requires a lot less human intervention. When you go up to the next one, coaching, it requires a bit more. And then the face-to-face, of course, requires the full human interaction. And so you're able to spread very, very expensive resources in clinicians, psychiatrists, nurses, psychologists. You're able to spread those individuals across a greater volume of service by being able to tailor the amount of service that's being offered for each group of individuals.
Tushar, you're on mute, sorry.
Is that I'll first go off of mute and then I'll continue actually speaking what I had said earlier. See how smooth that was? And that's also something that I think we need to speak about here is we've heard about the scale, right? So what can you provide from a scale perspective? And what do we actually need to provide? We've gone into this drastic situation. The general consensus amongst healthcare providers seems to be that we're going into another one of these fairly soon. It doesn't seem like we're, you know, if we're planning for this appropriately, we're going to go into another self-isolation period that may happen as soon as a month or two from now, or in the fall, especially when we hit flu season, we hit colder weather again, that we don't know the true spread of any of the of COVID-19 to date. And so we have to respond quickly. We have to have virtual mental health services. We have to have virtual services. And that there is also a stigma to actually go to physical services, especially amongst any group at this date, is that they would prefer mental health services given in a virtual environment rather than a physical environment. So it seems like the professions will have to adapt now to this new requirement, that even though that best quality of care to date might be provided in in a physical face-to-face environment, that the actual customer and patient preference would be in a virtual environment. And that if we don't have secure, and we can't express that we have secure virtual health services, they might not seek treatment at all. So now that we're in this period, we're in that mindset, what are some of additional areas to further enhance and secure the digital delivery of mental health services? Okay, this one, we're going to start with Karim first, then we'll go with Nicole and then Medha.
So I do think that perhaps first challenge the notion around stigma, because you've raised it a couple of times. And I think it's important that all of us, from a societal point of view, keep stressing that mental illness is just like any other illness, whether it's cardiac, whether it's kidney disease, or whether it's cancer. It's just like any other disease. There is a biological function that isn't working. There's nothing wrong with the individual, but that treatment needs to be provided in order for that individual to achieve their best, their best in terms of their contribution. And so I think if we as a society stress and work diligently on that message, it's an important part of reducing the degree of stigma that's associated with seeking care. Why would I be concerned about seeking care for my diabetes? Why would I hide from seeking care for my diabetes? And in the same way, why would I hide from seeking care for my mental illness? And so that's the conversation that we have to sort of attract and attack at the very core. People should feel very comfortable that they need to seek support. Now, having said all of that, we still need to find a way to be able to reach people in an environment where they may be at home, in an environment, as Nicole was pointing out, where they may be rural or in another jurisdiction. And we can do that. We can do that with the sort of technology that is available. We can do that through some of the technologies that I described earlier, whether it's virtual care or whether it's OTN, et cetera. So I do think it's possible for us to continue to do that, and it will extend access. So in the past, at Ontario Shores, we treated about 26,000 outpatient visits back in 2006. Last year, we hit 90,000 outpatient visits. That isn't possible if you're not investing in infrastructure, you're not investing in virtual care, because you can't manage that type of volume with the resources, the physical human resources that government provides. And so you have to find ways to be able to extend those clinicians in a variety of different platforms in order to be able to actually meet those types of volumes. So I completely agree we have to do it, but I want to make sure that we also do it in the context that we're not hiding from seeking care, but we're boldly seeking out care in the manner that's most appropriate for you as a patient.
I couldn't agree more. For me, my bigger concern is the type of training, or the focus that I have is strictly suicide prevention, suicide intervention. And not every person who has thoughts of suicide is suffering from mental illness. It's very important to understand that, because not everybody is depressed. It's that the thing that causes a person to go and start that journey down the river of suicide oftentimes is just something that's happened in life. It's a hiccup in life. They can't see any other way out. So when I'm speaking of the virtual world in that sense, it's harder to be able to talk somebody from being a place of having thoughts of suicide to agreeing to stay safe in a virtual kind of a setting. The challenge is that much greater. It's not that it's impossible. It's just very, very, very difficult. I mean, if it was impossible, then the crisis lines that exist would be pointless, but they're not. They're key, but they're just a tool. And oftentimes these people are physically, or being walked through the process. There is somebody there with them, and so for suicide prevention intervention, going virtual is I think a little bit more challenging in that sense. Like I'm not offering any assist training right now, for the simple fact that it's possible, and assist, by the way, is a suicide intervention training. It's possible to trigger somebody, because a lot of people who take it usually have some kind of history, either personal or somebody that they know have struggled with or committed suicide. And so because we can automatically potentially trigger them, we've been told not to offer the training because we can't deal with the triggered person while still providing the workshop. So that's the challenges that I face. And I mean, I'm open to any thoughts, but that's the reality when it comes to suicide intervention and prevention.
I agree with both Nicole and Karim on this. As a healthcare professional, we've been trained a lot on physical symptoms, but what we forget is body is connected. What your mental health affects your physical health, and they're not disconnected. And that is something people have to understand, that mental health is part of your health. So you cannot have stigma against it. You cannot be shy of it. You have to seek the care you need. Sometimes, unfortunately, society does put stigma on these, especially certain ethnic groups more so than the others. And we have to understand that because we live in a very multicultural society today. And that being said, giving them that option of getting care remotely is better than no care at all. So that is something we have to realize. If someone has that stigma that they don't want to go walk into Ontario Shores today, but they would rather take it online, let's give them those options. Let's provide them those options. We might not be able to give them the extent of care we need, which we can in person, but something is better than nothing. And that is where also knowing people that you bring on your platform, the healthcare providers that you bring on your platform, their ability to communicate remotely is also very important. They should be comfortable using technology to help. So those are some of the things that as an organization, we should be able to manifest.
All right. Thank you. Thank you all for that. I'm going to transition a little bit into the community-based questions, or the questions we've had from the chat. Preface them with a little bit. So the question from Saraiya was, I believe, which was in chat, was what do you say to somebody that is already experiencing mental health issues and depression while we are in full curfew and only connected remotely? I believe we've answered that previously already, and we've gone into that area. I do want to talk about lowering the barrier, though. And this will go into the question that was also asked by the community. So in the education, so the Ontario government did a survey several months ago, right at the start of the self-isolation period, where they asked students if they had access to a laptop, internet services, and a few other things. We saw that in the US as well, where school buses were being outfitted by Wi-Fi and being parked in certain locations to allow students to connect digitally. That was a form of lowering the barrier, to allowing students still to connect. There's been donations by companies of both bandwidth and other areas, and perhaps we should start to consider an internet a utility and a necessity rather than a luxury item or luxury good that you purchase. But how important do you think virtual care be in lowering the barrier for those seeking mental health treatment? And so we'll start with Medha on this one, then we'll go with Nicole and then Karim.
Tushar, it'll be extremely helpful in lowering some of these barriers because, as we talked about a few minutes ago, people who have perceived stigma or people who are uncomfortable talking to someone in person may feel more secure being behind a screen. And giving them those options and showing them the results or helping them see some of the improvements will help them and their loved ones realize the importance, and thus breaking down some of these walls that unfortunately have been created throughout the years.
I absolutely agree. As you're talking, the one thought that came to my mind with regards to lowering barriers is we have to consider that there's a whole population of low income that exists as well, right? So you know, lowering the barriers means you know, making sure that everybody is able to get that access, that they have the technology or even the connectivity to be able to do that. And so I love that idea about the school bus with the Wi-Fi. That's great. Yeah, absolutely. Lowering the barrier is key. It's super important, especially for our low income, because mental health is a huge issue. And teenagers feel so much more relaxed talking in front of a screen, for some of them, than talking face to face. You put them behind a screen, they're chatty boxes. You sit them in front of you, they got nothing to say. And so making this, it's just a matter of making everything more accessible. It's these days, yeah, absolutely more of a need than it is a luxury.
So 100% support the notion that we have to find a way to make broadband connection a necessity, a utility that is available to everyone. I just don't think that in a world where we've come to with COVID, that it's reasonable anymore to suggest that access to sort of high bandwidth, high resolution should be some sort of luxury. It's no longer the case. So completely support that notion. Having said that, I also think that barriers come in a variety of ways. We've talked about access to mental health because one is feeling stigmatized. So we have to lower those barriers. We have to make sure that people feel comfortable that they can access healthcare. They can access any healthcare without a fear of stigma. So that's a barrier. I think another barrier, quite frankly, is the patient or client clinician barrier. There's a power imbalance between those individuals, and that can act as a barrier. And I think virtualization actually lowers that barrier. If you think about what has happened in the private sector, you look at something like banking, there was always this sort of power imbalance between the banker, the individual who sat there and kind of reviewed your mortgage and told you whether or not you received your mortgage or not. And that's very different to today's environment, where in a virtual environment, people can access a variety of different providers, make decisions about a variety of different financial products, and make a decision about the rates that they get from those different financial products. So the power imbalance changes when you have information and virtualization taking place. And so I think virtualization will lower that barrier, the barrier around the power imbalance between an individual who's receiving care and one who's providing the care. So there's lots of these barriers, and I think it's the application of technology to assist in lowering those barriers and our work in society to lower barriers to access as well. And that includes making sure that things like broadband, the technology is available, stigma is reduced, access to transportation and things like that are available so that people can access services when needed. So all of those things, I think you need to take a look at to make sure that you've got good healthcare in society.
Okay. So thank you all again for that. We have about, and I'll just check with our moderator, we have about 10 minutes remaining in the session, correct? So I'm going to go back into some of the digital services and security element now, because we've spoken about access, the importance of access. We've spoken a little bit about security as well. So it's actually targeted to end at 11:45. That's okay. We'll just keep going. How about that? So one last question there, and this really goes on to the actual digital element and securing digital health, is if we start to change as we go through society now, where we start to push mental health services through digital, and how do we still prove trust in the system? Because, and we have to figure out a way to prove it in a simple manner, because many times what we're capable of going through and looking at an assessment and analyzing to see, is that really worth it? Is that stamp that's being given of approval there really a good approval? There might not be that same level of trust. So what trust stamp can we put on this that allows someone who's seeking virtual mental health services to actually trust the system? Because I'll tell you, I hear HIPAA, and I know high trust, and that doesn't mean I trust those systems that I'm using. from that perspective. In this case, we're going to start with Nicole, then Karim, and then Medha.
Well, I would say, and this is just me, but usually it would be word from a trusted source. For example, you're not going to go buy a product. If let's say somebody buys a product, they like it, they use it, and they tell you all about it, and it's that's somebody you trust, you're likely to go buy that product. It's the same principle, right? It's the word of mouth. That's how trust is usually gained, is by somebody else going through it, using it, putting it through the rigor, and then saying, you know what, I've put this thing through hell and back, and it works really, really well. So putting a governmental stamp of approval may not be enough. It may actually require somebody whom society has decided is an expert and is a trusted voice in that particular area, or to come forward and say, this is a trustworthy, this is useful, this is, and putting their stamp of approval, and then everybody else is going to jump on board. That's the consumer mindset, but that's how we roll basically for everything. So that's just the way I would look at it anyways.
Yeah, so I would approach it in a similar fashion. So it's from two different directions. One is that I do think that it's almost like a basic expectation. So there are behind the scenes, whether one refers to it as HIPAA or a government stamp of approval or whatever we call it, in the background, you need to be able to ensure that the information is secure and that you have systems that meet those standards. So the other is, I wonder whether consumers, to Nicole's point, have changed dramatically over the course of the last decade. There have been significant breaches in the US and in Canada, breaches of personal information, breaches of Facebook information, like you just go on and on and on. And yet the consumer is not moving away from the use of those technologies. They continue to use those technologies, they continue to put their information into those technologies. So I'm wondering whether the value of the connectivity that takes place with virtualization far outweighs the consumer's fear of loss of information. And so something has changed there. Something very radical has changed there. I don't think we abandon the need for extraordinary tight information protection, but that's more in the background in my view. That's just in order to play in this arena, you got to have that. And once you have that, then the consumer can make a choice about whether or not they're on your platform or not.
I agree with both Nicole and Karim on this. As a small business owner, as an entrepreneur in healthcare, some of the things that I really value is making sure that we do our back-end checks often, so our database checks, and make sure there are no breaches. We do our audits on a regular basis. But on the same point, be transparent. Mm-hmm. Being transparent gives people comfort. Like, be transparent. If something happens, be transparent. As Bruce mentioned in his keynote today about Zoom, being transparent when a breach happened.
Yep.
That gives, as a consumer, it gives you that thing that as a business owner, as a CEO, I'm not hiding what's happening. I'm transparent about it. And that builds that trust.
Yes.
And that to me is very valuable.
Yep. Agreed.
All right, thank you for everyone for joining today. Thank you to Nicole, Karim, and Medha for your answers and your time. The attendees, thank you for siberX for letting us run a little bit over on this. Hope everyone stays safe, has a great day, and we look forward to the rest of this conference. Thank you again, and take care.
Thank you.
Thank you.